Welcome to this webinar, everyone. For those of you who don't know me, my name's Russell Cartwright, and if you're new to the Public Health Communications Hub, here's a very quick intro. I set the hub up last year with the support of CAN Digital as a place where those of us who work in public health comms can kind of come together, where we sort of share best practice, solve problems together, and learn from each other. We've run lots of these webinars now, and recordings of them all are available on the hub. We are recording today's session, and this video will be shared afterwards. And then if you've got any questions for us, please put them in chat. Also, if you've got any suggestions for any topics or things that you'd like to see us cover in a future webinar or a future piece of work for the Public Health Comms Hub, please do put that in chat as well. So just to introduce myself, I've worked in the NHS in South East London for over 23 years now. I currently work part-time as Head of Communications, Engagement and Behaviour Change for NHS South East London, ICB. In the past few years, I've become a bit of a specialist in running behavioural science public health campaigns, and I've had some success with that, winning several awards, and really kind of developed my knowledge and passion. And now I split my time between working for South East London and also working with other in-house teams as a consultant to train and support them to run behaviour change, behavioural science led campaigns. I'll pass over to Edna, who's also taking part in this webinar. Edna, could you introduce yourself, please?
Hello, I was just about to take a lovely sip of my tea and realised that you were handing over to me. So hello everyone, nice to see so many people joining this webinar today. My name's Edna Boampong. I am the Programme Director working with NHS Confed, working specifically around improving diverse and inclusive communications activity, as well as improving diversity within the NHS comms profession. Formerly, I have been Director of Communication for Shropshire, Telford and Wrekin, Integrated Care Board, as well as Cheshire and Merseyside Integrated Care System. So I've got a lot of experience in delivering behaviour change type programmes, especially delivering campaigns to reduce inequalities, working with very diverse communities, and my background is in public health, but also service transformation within the NHS, and I've worked in the NHS for about 20 odd years now. So hello.
Thanks, Edna. And our other speaker, John Paul, is on the call, but is having some transport difficulties. So we'll hopefully be joining us soon once he's in a room. We'll get John Paul to introduce himself when he can. So just before, well, some of you might be wondering kind of why we've gone for a bit of a punk theme for this webinar. And you know, it isn't just down to my love of the Sex Pistols music. It felt very apt for the topic that we're covering. And, you know, we're not going to beat around the bush here today. You know, some of this stuff is quite hard hitting, but personally, I'm sick to death of seeing millions of pounds of public money wasted on public health advertising that doesn't work every year. And, you know, that can be down to, so I'm just struggling to move my slide on. That can be down to several different reasons. You know, it could be unscrupulous and very convincing salespeople pulling the wool over our eyes, or pulling the wool over our leaders' eyes, or things like that. It can be as simple as, you know, doing what we've always done, even if we have no idea of the impact, or because the time's against us, or that sort of thing. It can be due to pressure from others to be visible and get our campaigns out there, or get them where elected members or other stakeholders might see them. It can be down to us, you know, a bit of a knowledge gap, and us as the comms professionals not understanding, you know, the fast changing world of online advertising. And also, a really big one is, lack of adequate and robust measurement and evaluation. So those are just kind of some of the reasons why this money is wasted every year. I'm going to bring Edna in. See, she's got a T in her mouth again, which is sorry about that. But just to talk about the measurement and evaluation and the importance of that.
Okay, I'm just going to share my slides. Russell, just give me a thumbs up when you can see that. Can you see that okay, Russell?
Yes.
Yes.
Yeah, okay, good. Sorry, I get very uncomfortable with silence, so that's why I just needed some kind of reassurance. Okay, so some of you may have already seen me present some of these slides before, or a similar theme to you, and I guess this is really important right now, particularly in a time when the NHS, as we all know, is strapped for cash. I mean, when have we never been strapped for cash? But I think it's even more important now. I've seen also some headlines recently about one of the things that the HSC is saying is that they want to spend less money on communication campaigns nationally. It's just another way of looking at how they can reduce funding. Now, my personal feeling is that when the comms and engagement is delivered correctly, you can save the NHS money, you can reduce inequality, and you can ensure that organisations, you can ensure that comms supports the delivery of the organisation's strategic aims. When it's not, it can be a waste of money. And unfortunately, if it's not done well and we're not measuring the right things, often it's really difficult to prove impact, and it's really difficult to then keep making the case for why your team should, if you're in comms, your leaders should keep investing in comms. Now, what we often do, one of the things that can be quite visible is PR campaigns. Now, I know I've worked in corporate comms before, and one of the things we do when we want to raise awareness about something or spread the word about something is we put out a press release. And then what we do is we measure we measure the impact of the press release. But what we're all really looking at when we're looking at a press release campaign, or when we're doing a PR campaign, is things like how much media coverage, the extent of the tone and the reach of that particular press release. And what we often look at is the equivalent advertising spend. But we know that that's not the actual be all and end all. Because essentially, what we can't do really by assessing a press release is understand how well that message has landed and whether it's changed behaviour or not. What we're merely doing is measuring the inputs, which is the distribution of information to the news or the media, or the outputs, which is the publicity. And I'll talk a little bit more about that in a moment. And in a lot of senses, what you're quite often measuring is if the journalist likes what you've put out, because the journalists are often the people that will write the story in a way that they think is either suitable to their audience or depending on the slant they want to take on it. The other thing we often look at is our social media traffic. We look at how much engagement we've got from social media. We look at how much website traffic we've got, and often we can look at these really big numbers. Now, I'm not saying that those big numbers are not an indication of how well your messages is landing or how well you're engaging, but again, it doesn't necessarily tell us how much you've influenced people, or it doesn't necessarily tell us if you've changed behaviour. You can do the social listening piece, which is much better because it enables you to understand what people are talking about in terms of your brand or in terms of your message, but actually just looking at the numbers often doesn't give you the overall picture that you want. Outdoor out-of-home advertising as well. Put your virtual hands up if out-of-home advertising is something that you do quite often. If you've got the budget, great for visibility, but again, what you can't tell with out-of-home advertising is it doesn't take into account segmentation of your audience. So is it getting the right message going to the right people? And it also you aren't able to track out of home in the way that other mechanisms you can. throughout all of your marketing, your communication, what you actually should be doing is looking at whether there's been any change in behaviours, perceptions or understanding with your audience. I've just realised I was supposed to start a poll before I started speaking and I haven't done. So is it too late to do that, Russell?
No,
to put the poll up?
Yeah, no, I was just about to nudge you actually. Danielle, could you start the poll, please?
Absolutely.
This is seamless though, because it still fits in brilliantly here. Okay, you can see the poll in front of you, I hope. What I would like you to tell me is when you have used paid for advertising previously, what are the 3 main channels that you have invested in? If you want to click just 3 of them, please, and submit them, we'll just take a quick look at that. How does that come? Oh, is that on everyone's screen? Can people see that on their screens?
It should, yeah. It should, so yeah. It pops up on people's screens, and the results are in chat. Probably best give people a minute or 2 to do it, and then come back to the results, Edna. Okay, great. Okay, so I'll leave that up there. So I can see we've only got about 12 responses at the moment, and it's in the chat. So I'll carry on. I think the key thing for me is, is the poll covering the screen? Can people see the screen? So people can close it if not. I think it looks like actually for a lot of people, the bot with the poll has blocked, particularly NHS colleagues, I think. Yeah, apologies for that. If you can't see the poll, please do just put in chat, what you think your three main channels are. Okay, you should be able to do it in the chat. Even if the pop-up is blocked, you should be able to go into the chat and vote in the chat. If you scroll up, if you scroll to the top and then hit submit vote, you should be able to do that. If you scroll up in the chat. Okay, good old NHS technology, eh? It's blocked in the chat, I'm afraid. Okay, interesting. That's one. That's one to remember for next time. It is, yeah. So. Okay, so I think we've got about 13 responses through the chat, and most people are saying social, and we've got 34% that have said social media advertising, and then search. And I think radio and display ads are coming out the most. And let me just try and take a quick scroll down. Radio and social media out of home. Okay. So we've got a bit of a mix, but I think the main ways people are looking that use paid advertising is social media, out of home, and some newspaper advertising, some radio. So a bit of a mix. I really struggle to do a number of things at once, so I'm just going to move on, but thank you. We'll come back in a moment when we have a conversation afterwards to get a bit more of an understanding why it is that those are the channels that you pick, and if you find that those channels are the ones that work the best for you. As I say, I am a insight-led marketeer. So in my opinion, everything we do as marketing and comms profession really should be about reaching our audience in the right place with the right message, and as targeted as possible. I totally understand that sometimes from a corporate point of view, you do want to do that that mass comms and get messages out across the whole of the populations that you serve. But my view is, and my opinion is, if you really understand who you're trying to speak to and understand the mechanisms that they trust and resonate with more, you're more likely to make sure those messages land in the right way. So I've kind of devised what I say are the 5 steps to effective communication and marketing. The kind of, I would say, probably no-brainers, probably things that people have seen before. But I think when I work through these 5 steps, when I'm doing work or planning something, this helps me to kind of really focus and ensure that I can measure impact at the end of it. So first of all, as I've said before,
whenever you're doing activity, particularly if it's sort of money, if it's activity that you're spending money on, because normally if you are spending money on a campaign, that's usually because you want to in some ways change behaviours or opinions, or ensure people behave in a certain way, or do something in line with your organisational values. In order to do this well, you first of all need to align what your organisation objectives and strategic aims with your comms activity. So what is it that your organisation is trying to, what is your organisational objectives? What is it that are key things that your organisation are trying to do? So for instance, we're all in the depths of getting into the depths of winter now, and we know that we're all grappling with the winter pressures that we've got going on. So with that in mind, what is a key objective? So one of the key objectives possibly will be to divert activity from the front door of A&E, and that's if you're working in if you're working in the NHS. If you're working in local government, one of the things it could be is to try and prevent falls, which inadvertently would also then create more pressure in the health system, but also create pressure in other parts of the health and care system. So two very different objectives and different audiences to a certain extent. So you'd need to really understand your audience. You'd really need to profile that audience, understand where they live, their age profile, what drives their behaviour, what type of channels that they access, who are the opinion leaders or who are the people that they really respect their opinions of. So really understanding your audience is one of the things that's really going to help you deliver your message in the right way. You then need to develop a strategy. Once you've understood who you're trying to speak to and what you're trying to do, you need to develop a strategy that's using the appropriate messages in the right tone, in the right voice, and using the right methods and channels. Now, that's why I always say not one size fits all. I see a lot of campaigns that inadvertently increase inequalities because people run a mainstream campaign that focus on a particular audience, and what happens is they leave quite often marginalised groups behind. So you get people who will take on board some of the messages because it's delivered in the right tone of voice, in the right way to them. But those people that don't resonate with those messages, or it's not delivered in the right way, don't change their behaviour, and in that ways, the health inequalities gaps widened. We talked about measurements, and that's where Russell started. The point was about measurements. Now, measuring. Building a measurement framework from the beginning is really important. Now, when I talk about measuring frameworks, that means looking at your outputs, which is your reach. So that's quite often the big numbers. So what you would have is, how many hits to your website, how many social media impressions and engagements, how many people, how many things, or how many downloads of your materials or podcasts or whatever it is that you are wanting people to engage with. What are those big numbers? Those are your outputs. Your outtakes is usually if you've got any sort of budget to do any pre and post research. This is really important. Your outtakes give you an understanding of how people responded to your communications, or or where people saw your messaging. So we talked a moment ago about out of home advertising, and many of you said that you use out of home advertising. Well, how are you measuring that out of home advertising has worked for you? Because there's no measurements built into that. The only way to know if your out of home advertising has worked is to ask people, where did you see this advert? And once you asking them once you understand what the recall is, where people saw it, you then want to understand, what did people take from your messaging? Did they understand it? Did they change their behavior because of it? So that is that's your outtake, so your reactions and responses. And finally, this is the big one, it's the outcomes. What has actually happened as a result of the campaign or the communications or the marketing you've done? Has it led to a reduction in something, or has it led to an increase in something? This is where you see where if you've had any true behaviour change, or how much really your efforts have had the desired impact that you want. Use your measurement frameworks. Once you've got that measurement framework in place, use that consistently to measure and evaluate the success of your activity. You don't have to do that all at the very end. I would always suggest that you would always do a bit of a dip test halfway through your activity to give you an idea of if what you're doing is working well, if it's landing in the right way. And the important thing of doing it halfway potentially is that if you're realizing that actually people aren't quite getting what people aren't actually resonating if you're messaging in the right way or understanding your messaging, or it's not reaching the right people, it gives you an opportunity to flex, adapt, and do something slightly differently. Now, all of what I'm saying, people might say, well, we don't have the budgets to do big research, etc. You don't have to spend loads of money on doing these things to do pre and post research. You can, quite often what I do is I work with community organisations, and they often, for very small amounts of cash, will go out and talk to people on the streets and do some surveying. You can do it yourself through your engagement teams. You don't have to pay expensive researchers to do this work. Okay, now one of the things that Russell wanted me to do for this talk is talk about NHS Confed and the communication assurance offer that we've started offering to some of our members. Now, for those of you that know NHS Confed or don't know NHS Confed, we are considered the voice for health and care leaders. We're a membership organisation for the whole of the health and care system, and we cover ICBs as well as trusts. And we are in a unique position where we bring together and we support and speak for leaders and organisations across the sector, mainly through the NHS, but more and more we're working with local government. And one of our key drivers, and one of the things we've been established for, is around tackling health inequalities through our population health management approach, but also supporting with changes in policy or to drive forward policy that's going to improve health and care. We've got a department, quite a big department, where we're experts in communication and strategy development, and we are recognised across the health sector as thought leaders. We're also, because we kind of sit outside of the NHS, we're in a really unique position that we can actually, how should I put it, we can challenge the system. So we challenge NHS England all the time on some of the policies. We challenge the DHSC as well. So and because we're independent, unlike ICBs and trusts, and it gives us that unique opportunity to do that. The way that we often work is that we support partners to work, and we work with in-house teams, and we are very agile in our approach. Depending on what you might want us to help you with, there are some things that are covered as part of the subscription, as if you are a membership body, but there are some things that we offer on top of, which is an add-on if there are additional pieces of work that you want us to support you with. So things like we are working with some ICBs to develop bespoke EDI programs to support their teams to understand how to engage more effectively with their diverse communities. We also offer an evaluation and assurance program, which is all about us helping you look at from the start how best to evaluate your pieces of work, and at the end of it supporting you to ensure that you're looking at the right data and the right metrics to ensure that you can show that what you've delivered has had the impact that you wanted. So that's just a whistle-stop tour of some of the work that we can do and support you with in NHS Confederation. So my last slide, for those who don't know me and would like to connect further or understand a little bit more about the work that we do at Confed or the work that I've done for previous organisations in terms of some of the stuff around winter health, but also with ethnic minorities, please do get in touch with me. My email address and my LinkedIn details are on the screen. Okay, that's me. I'll stop sharing now.
Thanks, Edna. I'm just going to put my slides back on just for a second, actually, because there's a couple of things I meant to say that I forgot to cover. So just bear with me 1 second. And apologies that the poll didn't work. We've used those before, so I think something must have changed, because it's always worked before with NHS and local authority colleagues on machines. So either some security setting has changed or something. But we'll have a look at that for the next time. Yeah, so just bear with me 1 second.
Just whilst those slides are being found, can I just ask Edna how the Confed assurance aligns with the CQC ICS assurance? Because there's an inequalities element to that as well.
Yeah, this is very different. So we're not looking at what the CQC are looking at is more generally looking at the work that the programs that are being delivered to look at reducing health inequality. This is specifically around comms and engagement and marketing activity. So it's quite different where that's concerned.
Thank you. Please do keep any questions coming in the chat, and we will pick them up at the end. The bit that I just wanted to say was, I listed out some of the reasons why this is just really to build upon my punk theme. Listed out some of the reasons why we see wastage in the spend for public health campaigns, and this I think this is a real scandal. I also think that it's led to there being a bit of an underlying belief amongst some people in our profession, and certainly amongst some of our leaders, that local public health campaigns don't really work. And I know, and I've seen, that this isn't the case. Using a behavioural science approach and choosing the right channels, which are measurable, we can make a massive difference to the health of our residents. And so today is really all about challenging that status quo, and it is anarchy in the ad space. We're going to try and cover, and we've already done some. We're going to try and cover each of those areas and give you some helpful tips, around those. Stop sharing. So I'd just like to illustrate the point around kind of pushy and convincing salespeople. And I want to bring that to life with a recent example, which I'm sure will resonate with many of you.
Russell, sorry, before you jump into that, there's a few questions in the chat, so it might be worth that's related to some of my presentation. It might be worth just picking up on a few of those, if that's okay. Can we do that? Just so I don't lose my thread, okay. if that's all right. So someone's put in I think it's a VY has put in a question around how do you measure the behaviour change, especially when it takes a while for people to change and see the results, but with limited time and resources. I think you can measure behaviour change because it depends on, so absolutely there are some public health interventions and some behaviour change interventions that take quite a long time before you see any behaviour change. And that's why it irritates me sometimes when people are given a programme, given this short funding, and they're told to go and do this and expect massive impact in a short amount of time with very limited funding. So absolutely. Depending on the programme, it's quite difficult to measure that behaviour change in a short period of time. However, you can see a very immediate behaviour change with some things. So, for instance, if I talk about the Shropshire, Telford and Wrekin winter campaign that we did, the Think Which service, which was all about encouraging people to use different services rather than going to A&E. We had some of the worst ambulance handover delays. And we also had some of the worst performances, A&E performances in the country. And our campaign, while we did some research that showed us that people didn't understand that you could use a minor injury unit, you could use a pharmacy, and you could use other services for some of the things that they were going to A&E for. So first of all, we looked at the data and we could see that probably 2/3 of people that were accessing A&E could be seen elsewhere. And when we looked at what they were coming in for, we then realised that actually you could be seen in a pharmacy or some other part of the health system. So we delivered that campaign, and you could see almost immediately when people understood there were other services, and when we made sure that we talked about getting services in the right place and it'll be quicker for you, that the fact that they wouldn't have to potentially wait for 15 hours, 20 hours sometimes in A&E, and you could be seen in a pharmacy or a minor injury unit almost immediately, that was a key driver. So what we saw really quickly was a massive decrease in people, attendees at A&E, and also our ambulance handover delays went down significantly. So that's just an example of how you can see change in quite a limited time. Is there any other questions regarding
There's one about the geography that Confed covers. Is it just England?
No, so the Confed covers England, Wales and Northern Ireland, and we've got members across. So as I say, we cover all of the ICBs in England. I'm not sure about Northern Ireland and Wales, but I do know for definitely we cover as part of the subscription. But as I say, we offer a bespoke offer as well if people wanted the added value of bespoke interventions or support. We can look at that as well.
Thank you. Okay, so just going back to my my pushy and convincing salesperson. Like I said, I'm not going to name names, but I'm sure that this recent example is something that will resonate with lots of you. So I was contacted completely out of the blue on my personal mobile recently, which I assume they got from LinkedIn. Despite me saying I was on leave, he continued and tried to keep me talking for quite a long time. Followed up with a very glossy proposal outlining how this marketing agency can support us to run what they were describing as hyper-local targeting. It had a beautiful slide deck, video integrated, highlighting all their big brand customers that they work with. It had lots of jargon, but it looked and sounded very convincing. But actually, when you drilled down to it, when you looked at what they were suggesting, it was all out of home, print or broadcast media, all things that are difficult to measure on a local level. It also, there were lots of tricks of the trade that I've seen many a time before, attempts to build rapport, mentioning people I know, places I've worked, praising some of our local work that they'd found online or seen on LinkedIn, that sort of thing. So I went back to him, and I questioned how out of home is hyper local targeting and what evidence they have of real impact, and people taking action after seeing those adverts or hearing those adverts. And he did come back to me, to be fair. He came back to me with a long list of quite expensive, I'm sure, activities carried out for NHS clients, no outcomes whatsoever. So I went back again and I asked for some outcomes data, and he wasn't able to supply it. He gave me a load of stats like footfall and eyeballs on adverts, and those are meaningless. I went back again and he explained that hyperlocal means putting something in a certain geographic area. And also that they don't just do out of home. He was talking about printing onto coffee cups, coasters, pizza boxes and things like that. He mentioned that they use QR codes, but couldn't give me any data to show how many people scan them or how many people actually do anything with them. And eventually he admitted that the channels they were using are difficult to measure. He then brought up digital poverty, which is a valid point and is a point that all of us, I'm sure, do deal with all of the time. But what I would say is, I've got three things to say in response to that. The recent ONS data does show that 92% of the population are now online. That's not to say you ignore the rest, but a significant percent of our population are online. One of the campaigns he was showing was for the NHS app. So promoting that offline is irrelevant to people who are, digitally excluded. And also, those campaign activities that he showed me would have cost tens of thousands of pounds. Now, that money would have been much better invested in outreach. For that money, they could, the local NHS organisation could have worked with their voluntary and community sector and gone out and knocked on the doors of those people who are digitally excluded and talked to them about their health issues and helped them, navigate them through whatever issues that, we needed to do. So really, I just wanted to highlight that as an example that I'm sure lots of you will have experienced similar with. And I think, my tips really are, go back, question, ask for evidence, ask for real outcomes anytime you get that. And also, if they go to your leaders or whoever, do the same. Push back, make the case for being able to spend your money in ways that you can measure it. I'm now going to hand over to John Paul, who is able to speak now. And John Paul, do you want to introduce yourself?
Whilst John Paul's just doing that, sorry, Russell, I keep jumping in because there's still lots of comments in the chat. Just going back to VY's question. My background is in public health. So I actually started my career working in doing work around stop smoking, healthy way, alcohol reduction, etc., etc. You can absolutely measure impact, but you need to understand what matrix and what data you have, first of all, to then be able to look at what you're measuring against. So, for instance, teenage vaping data is really difficult to gather, and we know that because quite often people aren't declaring it. But what you can do bits of research where you can look at pre and post and understand people's smoking rates beforehand, and then run a campaign and look at people's attitude towards vaping, etc., or whether they've changed or stopped vaping after your campaign. Or you can look at data. So for smoking, for instance, 4-week quit data. Whenever you do a campaign, you can look at the 4-week quit data before you do the campaign, especially if it's very targeted in a particular postcode. You can then look at the data afterwards to see whether there's been an increase in people coming forward and quitting smoking. Healthy weight campaigns are the same. You will have data on this because you won't be asked to deliver a public health campaign and asked to reduce something if they don't know how much they want you to reduce it by. And so you will need to say to them, okay, where's the data? How will I know whether my campaign is successful? What is the data that we're using? So that's the whole point about understanding the data that you have at your disposal to then be able to deliver a campaign that you can track that data to see whether there's been any impact.
Brilliant, Edna. Thank you so much. And I just want to check that you can see this. This is really riffing on what you've just been saying, Edna and Russell. But I don't think it's always the people on this call necessarily that are having to make decisions about media. Sometimes it's put on our plate by other people, decisions already made and so on. And it can be quite tricky to be that little punk that stands up and points out that the emperor has no clothes. So I just wanted to give you some tips and tricks that we use when we're working with people that might help you diffuse requests for stuff that does not work. A very neat thing to point to is that we in the public sector aren't in the position to do everything we want to do. So there is always a choice to be made. You have to decide where you're going to put a pound. And this is very, very important, this filtration process and how you walk people or take people on a journey from what they think good advertising looks like to what actually works and what will deliver a measurable outcome. So I'd just like you to borrow, screenshot, these will be sent out afterwards. Excuse me. Some of these questions which you can use when you're prompted or asked by either a media owner, an agency, or someone internally to say, well, look, have we thought about Sky AdSmart? Have we thought about bus backs? Have we thought about these kind of things? what proportion of our target audience does this channel reach? And listen and see what's said. What was the cost per outcome from a previous similar campaign? Okay, and again, you don't have to prove your point. I think you just wait and listen. Have we used it before? What measurable results did it achieve last time? And if the answer is ever, oh, I don't know exactly, it's hard to say, these channels aren't measurable in that kind of way, it becomes very hard to make the business case for moving a pound from something that works to these sorts of channels. So I use these questions all the time. Another question I use is what happens if we did nothing? And that's interesting. But then also, what proportion of our target audience does this channel reach? And you can use that to look at organic social media, to look at a whole range of things, to identify where there might be inequalities built into the channels that you're using. But you can also use it to diffuse requests for channels that may not work. Next time you're at a bus stop or on a bus, have a look at what people are doing. When you're moving around in public, see where people's eyeballs are. Just look and then decide which channels you want to be on. What you can be showing people is what good looks like. So outcomes correlating with campaign interactions. And I think it's really important to show them that advertising isn't, oh, I saw our ad there. Oh, someone taking a screenshot of an ad, or someone seeing an ad out and about as they go about and thinking, brilliant, this is what we've done. Good advertising and good campaign management usually looks like this. It's not quite as sexy, but you can see outcomes and optimization and a stream of measurable outcomes happening as you work. And that's really, really important to get into people's head that that's possible. I think there are a lot of people making paid media decisions that don't even realize that can happen. And certainly from what we get asked quite a lot, that's a considerable thing. So how to diffuse, get people to look into the real world and show them what good looks like. I just want to show something on a recent campaign around a bus consultation. So not health, but here we had a few tens of thousands of pounds invested in programmatic advertising, online, targeted, that generated about 30,000 clicks and many, many more interactions. It also achieved the reach that the campaign required by itself. But at the same time, there was almost 3 times as much money spent on targeted mail outs, print advertising, out-of-home advertising, and this was all measured with QR codes, with search, with custom URLs. It was designed perfectly to be measured. So for about a quarter of the budget, generated 29 or 30,000 clicks, 170,000 interactions. The other 3 quarters generated 514. Now, I'm not saying that's the only value, but you can see here that a lot of the value was delivered by targeted leaflets. The out of home and the roadside did almost nothing. There were almost no clicks on those QR codes, which, considering it was the vast portion of the budget, meant that your targeted digital was achieving a cost per click of about 29 pence, and everything else was costing them about £81. Right, that's a big difference. Everyone knows that's a big difference. But if you're trying to communicate this to people who maybe don't quite understand or maybe aren't that good with numbers, try this approach maybe. If I rung you up tomorrow and said, I will reduce your energy bill by a factor of 2.7, you'd probably switch. That'd be, 100, 150 quid down to 35, 50 quid per month. Yeah, you'd switch. If I said I could reduce it by a factor of 27, you'd switch, and then you'd probably tell your friends, your family, people that you bumped into about how to get their energy bill down from 100 to 27 to about £3.50. That insight tells us that switching money away from above the line media to targeted digital is 277 times more effective. So for every pound you have in one, it's 277 times that in the other. A lot of people make decisions about improving efficiency by 20% or 30%. They'd be really happy to improve productivity by 20% or 30%. This is 27,000%. You shouldn't even use percent in that sort of size. So it's significant. Another way of pointing out to someone might be that if you were able to do the same thing to your commute, so you think about being on a tube or a bus for a long period of time, this would be like walking into reception, putting your hoodie on, and being beamed back home in 9 seconds. Okay, so it is a dramatic and vast improvement in outcomes. And I think we've got to be able to do what I call comms, communicate the effectiveness of that. And what we often see, and is quite normal, is the majority of the budget being spent on things that we know don't work. And that's not to say that there should be nothing going on out of home. Sometimes it can be free. Sometimes targeted mailings don't cost that much. And the majority of the heavy lifting is done by things that we know work, but get a small proportion of budget. And where we need to move to is probably a lot of targeted mail outs to very specific addresses where we know there is a digital divide. And the majority of our very limited budgets going into things that we know do work. So just to spell it out a little bit more, and these are meant to be tactics, not so much to patronize you, but to help you speak to other people in other places. If you want to get more for your money, certainly now and in the next financial year, you really need to move away from the kind of out-of-home bus radio side of things based on the data, which delivers very high cost per outcome, or sometimes zero or infinite cost per outcome because it does nothing, towards free and owned, so the council and the public sector's owned estate, search, remarketing, some targeted social to achieve low cost per measurable outcome. So I hope that's hopefully, if you take a few things from that will help you in future planning discussions. Back to you, Russell.
Thanks, John Paul, and thanks for getting through that. You sound quite rough. Just on, I mean, that 277 figure is like staggering. I think that blew my mind when I first heard that. I think one of the questions earlier was around being able to achieve behaviour change, and that taking time and not something you can do with a short burst. And typically what we do, we get a bit of a budget and we might run a campaign for a couple of months or 3 months or something like that, and that might change some people's behaviour in the short term, but it's not going to do it over the long term. And if we invested that money in digital channels, we could go for we could have that always on. We could have it, we can invest in the long term rather than just little short, sharp bursts, and really increase our impact. I'm just looking at if you have got any other questions for us, please do put them in chat. I can see that there is one which I wonder if you wanted to pick up, John Paul, if you're able to, which is from Susie in Cornwall. So it's just talking about Susie needs to do a campaign for the NHS app targeting older people who won't use it, but it's about kind of understanding the audience, and the campaign needs to encourage people who can use it on behalf of the older generation. So Susie's talking about a mix with traditional marketing, so older individuals could ask their support networks. Any pointers for Susie, or is that something that you could help with?
Definitely. Well, I wouldn't write off all people over the age of 55 as being digitally illiterate or digitally excluded. There are many examples. For example, Meta is a really strong channel to reach them. We also recommend augmenting that with news. So national and local news readership amongst that demographic is really high. I think one thing you've really got to think about with the NHS app, though, is the hurdles that there are to getting it all set up in terms of registration. So really think about that UX and providing step-by-step guidance for them to do that. I suspect that the latest smartphone penetration will decrease with that age group, but don't write them off. And I believe a lot of this is about demand management. So getting those who are able to use these channels to free up space for those who aren't. I often think that targeting adult social care, unpaid carers, people who are accessing adult social care content on council sites could be a really powerful way of reaching people who have caring responsibility, and helping them support somebody else. So yeah, those two things, don't write them off in terms of they're not on digital. Often they are, or a large proportion of them are, but incorporate news, so national, local news in order to target them, and then try and target the unpaid carer audience or the family member audience, which is normally a 50-ish-year-old female in those locations. And all of those things combined will mean you'll do a good job of keeping that channel in front of people. And then I would measure it and measure app downloads, which I know the NHS can feed back in that location, and also measure frequency of usage. So plan to prod people to keep using it once they've got it downloaded, prod them to register, prod them to use it in the future, because there will be barriers and there will be hurdles that people will need a bit of encouragement to persevere with. That would be my recommendation. If you want to have a separate chat, by the way, just drop me a line and I'll show you what's worked in other locations.
Thanks, John Paul. There is another question, but I'll let you have a break because it's for you, John Paul. But just summarising some of the things I think we've heard today. You know, some of those. There's some useful tips there about, you know, how you can try and persuade people that longer term investment and always on is the way to go, and how to try and stop doing some of the stuff that we've always done or that people like to see, or that, you know, councillors lead, and those 277, you know, times effectiveness. I think that is really, really telling. Just a few kind of things from me, and then we'll go back to the question in chat.
What was the other question, Russell?
It's about remarketing. If you just explain what that is. So yeah,
I'm very sorry. Yes. So
yeah. So I think just look beyond the big numbers that often agencies throw at you. Measure real actions. You know, Edna talked about output, reach, outtakes, but really crucially, how that all links to the outcomes. You know, the real actions that people take as a response when you measure things. Use channels that you can measure. If you can't measure them, then there's not much point. Use channels that allow you to profile and segment your audience so that you can reduce wastage. That match the channels, the best ones, to the ones that match your call to action. And think carefully about out of home. It's unlikely to be value for money, as we've shown. And if you do use it, you know, try and ensure that there is ways to measure it. I think another point of Edna's was around ongoing evaluation and not just doing it at the end. You know, learn as you go, adjust as you go. You know, if you find something's not working as you hoped it was, change it. You know, and dial up what is working. So John Paul, did you want to just explain remarketing?
Yeah, apologies. So remarketing is that thing that you see when you go and look at something online, and then when you leave that site and you're on social media or YouTube or a news site later on, you see that product. Sometimes it's, you know, a holiday or some item of clothing. And remarketing is that technique where you've looked at something, you've accepted cookies on that site, and when you leave and go somewhere else, you see that thing kind of creepily following you around. We use that technique for example, remarketing to someone that's visited respite care pages for unpaid carers, you know, and we can then, if they accept cookies, when they leave the council site, we can put certain messages in front of them. We've done a lot of it with remarketing to school term data pages. So people who go and look at school term data pages, we assume have childcare responsibilities, maybe parent or guardian, and so we put MMR and polio and HPV campaigns in front of them. So it's a really efficient way of using public sector first-party data rather than social media or online channel third-party data. And there's lots and lots of lovely little applications. And so, yeah, hopefully that explains it. It's the idea of someone being able to see your campaign based on what they've done on the public sector estate beforehand.
Thank you. Edna, I'm just going to ask you if you've got any kind of closing comments or anything you'd just like to say before we finish.
No, so I assume the majority of people on this call are either in the NHS or they're in local government. So I guess what I would say is I absolutely hear and feel your pain. I've worked in both of those organisations, and I've worked in organisations where people want unrealistic results very quickly for very little money or very little budget. That seems to be the trend of what happens in the NHS. And in local government, and also you get asked to deliver things which is going to be really difficult for you to be able to demonstrate impact, because quite often you get senior leaders that just say, we've got a problem here, we want you to solve it, and they think comms is going to be the silver bullet. What I would say is push back. Don't always, even because they're giving you a small amount of budget, just say, yes, okay, we can do it. I think go into it with an inquiring mind, ask the questions. I often use the SOSTAC planning tool, where you kind of you work through with the leader or the program lead or the commissioning person, just a real understanding of what's the situation, what problem are you trying to solve, who do you think you're going to target, when do you want to see results, etc., etc. So if you actually do some planning up front and actually set the expectations up front about what you think you can achieve or can't achieve, or what you need from sometimes your program teams to be able to help you deliver the work that you need to do, I think that will stand you on good stead. And sometimes you might just agree, we can't necessarily prove impact, but we're going to do this campaign anyway because we want to get a message out there. Now, I'm not advocating that approach, but sometimes you do find that people just want you to do a big bang campaign where all of the stakeholders can see this poster up on this billboard or this message out on the bus. Now, I don't think that's the right approach quite often, but I do get sometimes needs must.
Brilliant, thanks, Edna. Just before we close, I'm just going to give a shameless plug to next week's webinar, where we're focusing on using behaviour change to help people quit tobacco for good. I've got some great speakers. It's next Thursday at 1 p.m. Those of you who signed up to the hub will get the invite for that automatically. So yeah, thank you so much everybody for joining. It's great to see so many people, and yeah, take care and see you soon.